Here are the bones and regions you will need to know for lab. The skull. Here are the bones and regions you will need to know for lab. Major skull regions: 1. The cranium. 2. Facial bones. Recognize it from the following views: anterior/posterior, lateral, inferior. Interior views: cranial vault, cranial floor. 2. Facial bones: cranium, cranial floor, anterior cranial fossa, middle cranial fossa, posterior cranial fossa. Cranial vault, the superior aspect of the cranium, its ceiling. 6 bones make up the cranium. There are 6 cranial bones: frontal, parietal, occipital, temporal, sphenoid, ethmoid. These 3 are easy. This is easy, but has many parts. This is harder. This is the hardest. Occipital bone has the foramen magnum through it. Has the occipital condyles on it, to interact with the first vertebrate to shake our heads yes. Temporal bone. Other prominent features: 3 main regions. Styloid process, mastoid process, zygomatic process. External auditory meatus, mandibular fossae, carotid canal and jugular foramen. 3 main regions. 1. Squamous. 2. Mastoid. 3. Petrous. Sphenoid bone, general. Visible on a lateral view, between the frontal and temporal bones. Visible on an inferior view. Visible on the cranial floor. Visible within the bony orbit, positioned posterior and laterally. Sphenoid bone, specific regions. Looks like a bat. Greater wing. Lesser wing. Has the cellator succa. Visible on cranial floor. Holds the pituitary gland. Has the optic canal through it. Ethmoid bone, general. Not visible externally. Only present medially within the cranium. Forms the posterior margins of the nose. Visible on the cranial floor. Visible medially in the bony orbit. Ethmoid bone, specific regions. Cribriform plate has pores for olfactory nerve to traverse. Crista gallia ascends into cranial cavity. Perpendicular plate descends to meet the vomer. Superior and middle nasal conchae are parts of the ethmoid bone. Facial bones, most, but not all, are visible from the exterior. Give shape to the face. Some are involved in the bony orbit. Maxillae and mandible. Maxillae, upper jaw, lip, and medial face. Paired and fused. Contribute to bony orbit. Form most of bony upper palate, the palatine process. Mandible. Only movable skull bone. Lower jaw. Has the mandibular condyle and the coronoid process. Contains mental foramen. Other obvious facial bones. Zygomatic bone. The cheekbone has a temporal process. Nasal bone at the superior border of the nose. Less obvious facial bones. Palatine bone forms the posterior edge of the bony upper palate and the inferior nasal concha. Vomer bone runs vertically, dividing the nasal cavity in 2. Lacrimal bone. Medial aspect of bony orbit, tear duct passes through this. Bony orbit. 6 bones contribute: frontal bone, zygomatic bone, sphenoid bone, maxillary bone, lacrimal bone, ethmoid bone. Additional items to locate: superior orbital fissure, inferior orbital fissure, supraorbital foramen, infraorbital foramen.